Gastroesophageal reflux is the most common disorder of the GI tract. It affects millions of people in the United States, and there's a wide spectrum of disease severity. There's many people that have intermittent reflux that's well controlled with a medication several times a week or avoiding certain dietary triggers. On the other hand, there's many people who have severe disease, daily symptoms that are not controlled with medications, keep them up at night, and they've tried any number of proton pump inhibitors with varying degrees of success. These are patients that are good candidates for surgical management of their reflux disease. Surgery is a great option for significant reflux disease, and it approaches it from a completely different paradigm than medical management. Surgery hits reflux at its source. It provides the barrier function to prevent the acid from leaving the stomach and going into the esophagus. Anatomic considerations for reflux surgery involve the presence of a hiatal hernia, which is very common in patients with severe disease. A hiatal hernia is a hole in the diaphragm through which the esophagus is supposed to pass, but in the case of a hernia, it's gotten larger than it should be, and so a portion of the stomach goes up into the chest and is acted upon by those forces and results in worsening of the reflux. Patients with severe reflux, by definition, have a weak sphincter muscle that separates the esophagus and the stomach. It's called the lower esophageal sphincter. Surgery for reflux reinforces and augments that sphincter muscle in several different ways. One way is by means of a device called the Lynx device, which is a bead of magnets that's placed around the lower portion of the esophagus and prevents acid from going from the stomach into the esophagus. Another approach is a fundoplication, which is a wrapping of the stomach around the lower portion of the esophagus to also reconstruct and augment the valve, which is weak in patients with severe reflux. One of the wonderful things about surgery for reflux is that it can all be done laparoscopically, which means small incisions, a camera, long instruments, to do these complex operations without the pain associated with a large incision. Many times these operations allow the patient to go home the same day. All of these operations allow return to normal activity within a week. Here at Northwestern Surgical Associates, we see a wide spectrum of disease, everywhere from people with esophageal cancer caused by chronic reflux to patients with morbid obesity who also have significant gastroesophageal reflux. One of the benefits of our practice is that we bring an expertise to deal with all of these problems under the same roof. And so we can tailor the operation to fit the needs of the individual patient.